Hi.
Hello, everybody. My name is Ken Abrams. At Deloitte, I serve as the firm's Chief Medical Officer.
Good afternoon, everybody, and thanks for taking the time to spend with us again today. I get the privilege of hosting today's discussion, where we'll talk a little bit about virtual health and specifically focus on some of the concepts around the ability to deliver hospital-level care at home. I am a physician. I'm an anesthesia critical care doc by training, and then I joined Deloitte 9 years ago now. I'm Deloitte's Chief Medical Officer for the U.S., and have the privilege of working with a group of about 65 physicians, clinicians, and scientists in the firm as we serve clients in lots of different ways across life science and healthcare. What do you think is going to happen over the next 3 to 5 years with devices in the home, hospital level care being administered in the home? Right now we're going back to Marcus Welby, which I should have said earlier, right? But where is all this going to take us? And in order for this to create the continuity of care that we were talking about earlier, that Anna, I think you brought up, and Alana reinforced as well, what has to be true for all of this to really take hold, and for us not to call this virtual health or hospital level care at home, but to just call it health and care?
There are so many new devices on the market that incentivize consumers to run a little bit faster. For instance, there are headphones that tell you, okay, you're slowing down, go a little bit faster. Different devices that can motivate you in different ways. The issue being that these can be really cost prohibitive for consumers. And even in speaking to the panel last week, and a lot of times when I'm writing an article or working on a story, a lot of times my editors say, okay, remember, we are in New York, but you're writing for Middle America, and the things that you're up for doesn't, sometimes it doesn't resonate there. And I think that one issue is the cost issue. A lot of these devices are over $100, usually minimum, right? Mm-hmm. The newer ones are even pricier. And I think that there's also an issue with privacy, that we all echoed this concern of this data being fed to an insurance company or elsewhere.
Where we're going 5 years, 10 years from now are from who did you say, Marcus Welby, to real Star Trek, where you walk in, your home, we'll make it the right temperature, we'll read your temperature, we'll hear if you have some asthma, if you have some kind of flu symptoms, if you have a cold, if there's a little hitch in your get up and maybe you're stiff or sore, or homes are smart-ish now. 5-10 years from now, all of that will be built into our homes and into our surroundings. But back to Anna's point and Robin's point, it will be cost prohibitive for the average person.
Two significant things. One is just getting the whole quote unquote world used to using these new technologies that have been around for a long time is one significant transformation, is just the user adoption, both on the provider side as well as the patient side, as well as just workflow, getting it just sorted out. The second big thing is improving design. Now it's all fragmented. They're all impossible. We need to have beautiful, invisible design where people aren't thinking about issues like privacy or how to turn something on or off. It's just got to work. And more consumerism, more retail kind of design experience built into the whole process. And I think we'll see a lot more of that over the next 5 years.
Now, if you could just afford it, that would be the icing on the cake.
At scale, the prices will come down. It's just going to take time. And we were talking about ultrasounds. Those at-home ultrasounds used to cost $100,000. They're now a few $100s.
I do want to thank everybody for participating today. This has been a really engaging and stimulating conversation. I have learned a ton from all of you. So thank you for sharing your thoughts and participating. We really do appreciate it.
Thank you, everyone.
Thank you, everybody. Have a wonderful week.
Stay well, everybody.
Stay well.
Thanks for moderating. Take care.